Sleep apnea literally means stopping breathing while we sleep. Sleep apnea is common. The prevalence is about 15% in men and 5% in women. The risk factors for sleep apnea include age, male gender, obesity in particular, people with renal or kidney failure, people with congestive heart failure, or those who've had a stroke, those who take sleep medications, or drink alcohol in excess of 2 alcoholic beverages per day. The cause of sleep apnea is a collapse in the airway. We don't understand why that happens, but the airway collapses and doesn't permit oxygen to travel into the lungs and then be dispersed throughout the body for the appropriate vital organ function. So that when people stop breathing during sleep, their blood oxygen actually falls, which is one of the reasons that sleep apnea is such a serious condition. The symptoms of sleep apnea in particular include choking and gagging during sleep. Also, sleep interruptions. If your bed partner witnesses you choking or gagging or stopping breathing during sleep, it's likely that you have sleep apnea. But also, in addition to that, loud snoring is one of the symptoms of sleep apnea. And in terms of perception of sleep apnea, non-restorative sleep, feeling like you just didn't get any sleep during the night, or excessive daytime sleepiness, falling asleep at traffic lights, falling asleep at your desk or on the job, are all symptoms that you may experience because of sleep apnea. But there are some really more important consequences. People with sleep apnea are much more likely to have hypertension. They're much more likely to have depression. It can lead to dementia, as well as other cognitive dysfunction. People with sleep apnea are much more likely to get congestive heart failure, have renal failure, and they're much more likely to have coronary artery disease, cardiac arrhythmias. All of these are consequences of reduced oxygen to vital organs. So the consequences of sleep apnea are serious. This is a serious medical condition which demands that you get it appropriately diagnosed and treated. Other consequences of sleep apnea include increased motor vehicle crashes. Individuals with sleep apnea are much more likely to get in motor vehicle crashes. That makes it a public health problem. Individuals with sleep apnea are more likely to have accidents around the home. And they get more often have diabetes and fatty liver disease and overall increased all-cause mortality. So how do you diagnose sleep apnea? Well, you go to a laboratory, or the laboratory comes to you. A technician fits you with a mask that surrounds your nose and your mouth, hooks you up to an electrocardiogram and an electroencephalogram, and then evaluates and monitors your sleep or those functions during sleep, to include a video camera to see if you have things like restless leg syndrome or excessive sleep movements, so that your electrocardiogram is taken, your electroencephalogram and your brain waves are taken, and your oxygen is measured, and how many apneic episodes you have during sleep. If you have, when you go to the laboratory, 15 or more apneic episodes per hour, that meets the diagnosis of obstructive sleep apnea. Once that diagnosis is made, what's called a CPAP titration is performed to see what level of continuous positive airway pressure is necessary to effectively obliterate the apneic episodes. The treatment for sleep apnea, most importantly, is CPAP, continuous positive airway pressure. And that's done by putting either a nasal device or oral nasal device over your mouth, wearing a harness, and having continuous positive airway pressure instilled into your airway to keep it from collapsing. Now, a lot of people don't like the idea of a mask, and so they stop using the device. There's a way around that. This is an example of a harness with what's called a nasal pillow. This just goes over the nose and into the nostrils, and effectively instills positive, continuous positive pressure to keep that airway open and to obliterate the apneic episodes that happen Dental devices have also been used with some success in certain individuals. Surgery is also recommended by surgeons, but the results are disappointing, and I would urge you in all respects to avoid surgical maneuvers to treat sleep apnea. Use that CPAP, it's not that bad. And once you get restorative sleep, and once you feel better during the day and you can think more clearly, any intrusion of a mask or a nasal pillow will be well worth the benefit that you receive. This is Dr. Jim for Be Healthy, Be Happy. Treat your sleep apnea. Take care of yourself. Power your path to happiness, and subscribe to Be Healthy, Be Happy with Dr. Jim.